Thanks for joining us here on 24 Plus this afternoon. I'm Lauren Turman, here to give you an update in the federal trial for Memphis gynecologist Dr. Sanjeev Kumar that has been going on for nearly a month at this point. First and most importantly, we do not have a verdict right now, and the jury is still deliberating. About an hour ago, we were told by our team that we have inside of the courtroom that jurors asked that if they do not have a verdict by 5:45 today at the latest, they have to come in for the rest of the week because of the holiday. The court then decided that they do not have to actually come back until Monday, so we might not have a verdict until next week. But because there was so much information and an abundance of different charges and witnesses, statements and evidence to keep track of in this case, since everything happened at the beginning of this year, we are here to give you an update as to what has happened in this trial since the beginning of the month. So first, Dr. Kumar was charged with 16 counts of single-use reusing devices, 16 counts of rebranding reused single-use devices, 4 counts of improper handling of hysteroscopes, and 10 counts of healthcare fraud. Now, we want to take a look about how we got here and give you a little bit more information leading up to this point. Back in February, Dr. Sanjeev Kumar was charged with enticing patients to travel to his Memphis clinic to engage in unlawful sexual activities. Also, as we just mentioned, reusing some single-use medical devices, rebranding some reused single-use devices, and healthcare fraud. Now, we're going to go over all of what that means a little bit later here, but in April, a judge is allowing him to continue his practice under certain conditions. That includes seeing if he used medical use devices multiple times. He also had a supervisor in the room during some of his examinations, and he was not allowed to treat children without court approval. In October, the sexual charges against him were dismissed, including some things about taking people across state lines and committing sexual acts. Those were dismissed, but the other charges remained, leading up to his federal trial that started on December 1st. Now, during the first week of this trial, federal prosecutors called 7 witnesses to the stand, all of which gave some very important testimony about things like billing, what happened inside of that Poplar Avenue clinic, and what Dr. Kumar had instructed them to do according to what they said there. A former assistant says she saw medical devices being soaked in some cleaning solution and being reused, and that they were told that this was a common practice to be done at that clinic. Another assistant telling the court that billing records from the clinic did not match the number of examinations that she remembered performing. Billing is a very large part of this case, including some TennCare fraud and some other issues that happened in terms of patient billing and some fraud. We're going to discuss that later as well, but she claimed that multiple violations were at his clinic and in his records, and that Medicare and Medicaid were being billed for procedures that patients did not need. Now, during last week's closing arguments, the prosecution had reminded jurors about some text messages between Dr. Kumar and members of his staff on multiple occasions, and how he financially benefited from some of those procedures, billing nearly $40 million from Medicare. Now, one of the last witnesses to take the stand during the first week was the Deputy Chief Medical Officer for TennCare, and a criminal defense attorney, Art Horn, who does not have any involvement in this case, gave us some insight as to how that testimony could shape what eventually happens with Dr. Kumar's license if he is found guilty. Take a listen.
It may be a situation where we just give up his license and he be allowed in 5 or 10 years to come back and ask to be reinstated as part of a settlement with the medical board.
So, of course, some interesting information there to see if his license is eventually reinstated or what exactly happens there with the pulling of that. Now, the defense also pointed to the fact that Dr. Kumar is a specialist and says that this is why he has done so many operations on patients. They also said that he has been charged for things done by other staff members in his clinic, not him. Now, that also reflects a lot of what I'm going to tell you next about some of Dr. Kumar's testimony when he was up there. Of course, in cases of this size and with this many allegations against him, we've seen historically that there have been some differences between what medical staff is actually saying versus what the doctor who is instructing them to do these things is saying. And that reflects a lot of what he said on the stand. He said he regularly consulted with doctors about patients being diagnosed after referrals and never never received complaints about the number of biopsies he performed. He also disputed some former assistants' claims that patient records were hard to access, and he instead said that all of the staff were trained to find and review all of their records on a daily basis, and that he never received any complaints about that. He also asserted that the device instructions had allowed for them to reuse those devices after some proper disinfection and sterilization, and emphasized that all of the staff were trained on some cleaning protocols by some of the outside parties. Now, we also heard from another former assistant of Dr. Kumar's. Her name was Dr. Huda Aladdin Hussein. She shared her experience while working at the clinic and also says that while she was working there, things were overwhelming, saying the clinic would see anywhere from 20 to 70 patients in a single day. And Aladdin also said that Dr. Kumar would push for more procedures that might have been allowed for, and that payments would work and be frozen eventually when it didn't meet Dr. Kumar's standards. So again, going back to some of the earlier points and some of the larger accounts that have been taken against him about billing fraud, about reuse of some devices that should not have necessarily been used there, her testimony really shaped a lot of that and what was going on with the activity in that clinic day to day. Now, later she clarified that that was not Dr. Kumar's sole reason for holding out some of those payments. Now, walking you back to a little bit more of what has happened this week, the jury started deliberating around 9:30 yesterday morning. Again, the trial has been going on since December 1st, so they've had several weeks leading up to this point. Now, after hearing closing arguments from the prosecution and Kumar's defense team, of course, there were some statements that were made towards the end of this all that are important to talk about at this point. One of the larger points that initially came from one of the assistants who testified mentioned a 2024 FBI raid that happened at his Poplar Avenue clinic and some of the conditions that the staff had to go through in terms of talking about medical devices, cleaning procedures, all of the things that had otherwise been stated in this case. They talked about the government having multiple opportunities to contact Kumar following that raid, but saying they did not. Now, that comes from a lot of the statement from his defense team. They were also talking about some of a lack of evidence that has been presented, specifically relating to reusing and maintaining some of these devices that he is accused of misusing in this case. And they also said, in terms of the finances, that Kumar made a $165,000 investment into providing some of the best care for all of his patients there. Now, I spoke with one patient several times this year from when these charges were brought up against Dr. Kumar to October, when some of the sexual assault charges against him were dropped. Her name is Corinne Oliver, and she really talked about what she has been going through physically and emotionally since she had started seeing Dr. Kumar several years ago, saying she wasn't able to eat, she wasn't able to sleep. But recently, she started talking to a therapist and got better on the right foot and is starting to regain some of her strength back. But I want you to hear directly from her what she told us back in October.
I cry every day, just devastated about what happened to me, and I just couldn't move forward.
We first met Corinne Oliver, a former patient of indicted gynecologist Dr. Sanjeev Kumar, 6 months ago on this couch.
He gave me chemotherapy when I did not have any kind of cancer, and it nearly killed me.
After we spoke with her in March, she says the FBI reached out.
The FBI representative that I was assigned to is from New York, and she sent me to a crime victim center here in Memphis.
Now, she finally feels comfortable talking to her counselor. But Monday, a new reality hit. Kumar, who was accused of reusing disposable medical devices and coercing women into sexual acts both across state lines and at the Poplar Avenue clinic, filed a motion to dismiss the case. And on Friday, a federal judge approved a motion dismissing 17 of 36 charges against him.
I was so devastated. I could hardly get my breath, I just couldn't understand for what this man did.
Among those dismissed charges include 4 counts of enticing women to travel and engage in illegal sexual acts, 7 counts of adulteration of single-use devices or intentionally making them harmful, and 5 counts of misbranding of reprocessed single-use devices. Dr. Kumar now faces 19 charges, including 10 counts of healthcare fraud. Corinne tells us that even with the remaining charges, she wants justice to be served.
regardless of what that judge said, I know what he did to me was not, there was no reason for him to do what he did to me. The medication he gave me couldn't do anything to me other than hurt me.
And again, you just heard from a former patient of Dr. Kumar's, Corinne Oliver, talking more about what she had experienced under his care. Now, if you're just joining us here on 24+, we're going to reset and take another look at the charges against Dr. Sanjeev Kumar. Again, in his federal trial, the jury has not reached a verdict yet. They are still deliberating, but we could receive a verdict today or anytime into next week as well, because they have asked for an extension with the holiday upcoming. Now, taking another look at what he is charged with, it includes 16 counts of reusing single-use devices, 16 counts of rebranding single-use devices that are reused, 4 counts of improper handling of hysteroscopes, and 10 counts of healthcare fraud. Now, according to LinkedIn, Kumar opened his clinic about 7 years ago, but before that, he worked as a gynecologic oncologist at Baptist Memorial Healthcare. Now, it is important to note that in all of this, according to his indictment, everything that he was accused of doing took place at his own clinic on Poplar Avenue in East Memphis. That was the Women's Health and Med Spa, not at any of his previous workplaces or facilities. And again, it is important to note we do not have a verdict yet. Just to reiterate for you, the jury came in earlier this afternoon and asked the judge that if they have not reached a verdict today by 5:45 p.m. at the latest, they asked the judge if they will have to come in on Friday, because of course, with New Year's Eve and New Year's Day, court will not be in session. The judge then told them that they do not have to come in on Friday, and so they will be back on Monday if they do not reach a verdict today. Again, we don't have any timeline. We're not exactly hearing anything, but we will make sure to keep you updated as soon as we do receive that verdict and any other important information here. You can be sure to stay with us right here on the 24+ app and on all of our ABC platforms for the most up-to-date information. We will be providing all of that to you as soon as that verdict comes out. Thanks for joining us.
Continue with us and watch free now on the 24+ app everywhere you stream.